Bismillahirrahmanirrahim. Assalamu alaikum everyone. I am Dr. Mubashra and today I will demonstrate cardiovascular examination steps. This video is going to be very useful for MRCP PACES candidates as well as for FCPS and MD medicine residents and for MBBS students as well. I will follow a structured step-by-step approach just like what the examiners expect from you and will tell you which findings to look for at each step of your examination. So let's start. First of all, which commands you can get in the exam? Examine the precordium and do the relevant, or examine the cardiovascular system of this patient. Your steps of examination will be modified according to the command you get. So listen to the command very carefully. Also, sometimes for PACES candidates, the command can be written on a piece of paper hanging on the wall. After this, the first step of your examination is sanitize the hands, greet the patient, introduce yourself, take informed consent, and then exposure and position of the patient at 45 degrees. Then begin with inspection from the foot end of the bed. Look at the patient's general appearance. Are they comfortable, breathless, cyanosed, or using oxygen? Scan for clues like chest wall deformities, surgical scars like sternotomy scar, thoracotomy scar, pacemaker, ICD scars, oxygen cylinder, or any bedside medications. Next is hand examination. In the nails, examine for clubbing, splinter hemorrhages, and capillary refill. And in the hands, examine for peripheral cyanosis, nicotine staining, and peripheral stigmata of infective endocarditis, for example, ossular nodes and Janeway lesions. Next, palpate the radial pulse for rate, rhythm, volume, and character. Check for collapsing pulse by raising the arm, then compare radioradial and radiofemoral delay. For MRCP PACES, do not perform radiofemoral delay step because you cannot examine directly on the clothes. Just offer this step to the examiner and then check the blood pressure, or examiner may ask from you to skip. Radioradial delay suggests subclavian stenosis and radiofemoral delay suggests coarctation of aorta. Then comes face examination. In eyes, look for conjunctival pallor, jaundice, xanthal asthma, and corneal arcus. In mouth, look for central cyanosis and high arch palate. As a general inspection, examine for malar rash in mitral stenosis or any syndrome-like look of the patient. In neck, assess the jugular venous pressure, its height, waveform, and whether it rises with hepatojugular reflux. Before moving to precordium, let's revise the areas on precordium like mitral area, tricuspid area, pulmonary area, and aortic area. And here again carefully look for scar marks, deformities, and visible pulsations. Then locate the apex beat, its position and character. Palpate for left ventricular heave and thrill, that is palpable murmur. Then comes auscultation, which involves auscultating systemically at the four valve areas, that is mitral area, apex, tricuspid area at the left lower sternal edge, pulmonary area at left second intercostal space, aortic area at right second intercostal space. Listen for heart sounds S1 and S2 and comment if they are soft, and added sound, for example S3, S4, click, rubs, and any murmur. Ask the patient to roll to the left side and use the bell of stethoscope at the apex to listen for mitral stenosis murmur. After this, ask the patient to sit forward in leaning forward position, hold their breath in expiration, and listen with the diaphragm at the left sternal border for the murmur of aortic regurgitation. Back examination. Examine the back for sacral edema and lung bases for fine crepitations. Examine the legs for peripheral edema and plantars in few cases. Then, in the end, say to the examiner, in order to complete my examination, I would like to check the blood pressure in both arms and check for peripheral vascular disease. This completes the cardiovascular examination. The key in examination is not only to examine thoroughly, but to present your findings clearly and confidently. Structured, sequence, and systematic coverage will help you score high. In my next video, I will tell you how to present your findings of cardiovascular case in the exam. Thank you so much for watching. Stay blessed. Allah Hafiz.